Cox, physical therapist with advanced sports and spine therapy in the Portland, Oregon area. I got started with McKenzie method at about 16 years ago now. Took my first course back then. Had never actually planned on taking a McKenzie course, but my wife was working at Advanced Sports and Spine at that time, and I had to go through the coursework because that was a system that they really valued, and that we still value, obviously. So I took the course with her, just kind of go take the course, and was like, oh, there's maybe something a little here. And then she had to go through course Part B, and so I took the Part B course, and I was like, oh, maybe there's a little bit more here. And then I took the Part C, and that's where I really kind of then started to see what I could do and how I could change my practice with it. And so that was, like I said, about 16 years ago now that I took my first Part A course. And then I got certified in 2010 and thought that was actually kind of where I was going to quit and be at that point of just a certified clinician. And I was happy with that. And then I actually joined on to Advanced Sports and Spine Therapy 2012. And so highly, valued as a system. We had another diploma therapist at the time. All of the therapists were either certified or going through certification. And so that allowed me the opportunity to go through and then do the diploma program. And so I started the diploma program in 2015 and finished in 2016. And again, thought I was done, and came back from taking my diploma exam in Miami that summer, and had to tell then my wife that I'm not done. I'm actually going to go through and do the fellowship. So I actually ended up completing the fellowship, the McKenzie Institute's fellowship program just a few years ago. So that's kind of been my path through the system. I think people have been open with the changes that we've had to go through. I'm grateful I took that first Part A course 16 years ago because I think MDT was made for social distancing. So it's a system that empowers the patient to be able to manage themselves. And so even in our normal day-to-day interactions within a clinic, few patients actually need hands-on techniques. And so you might be sitting across the room from them anyways as you're assessing their response to repeated movements or a sustained position, and really educating the patient on how they're going to then, based on that, take this movement or that position and manage their symptoms. So it's been, they've responded well to that. And then I think our patients left the clinic when we kind of started slowing down, feeling a little bit more confident that they could self-manage their condition. I've still tried to keep up, and we've had our therapists still really try to keep up with weekly communications with the patients. I might have had 1 or 2 visits with a patient on a week on a normal basis. I'm still trying to make sure, whether it's an email, a phone call, a telehealth session, still trying to make sure I'm getting those touch points with the patients though, and just making sure that they are progressing along and answering any questions they have. So we just don't have as much face-to-face time. But I think because of the system that with MDT, I think our patients have responded well to the circumstances. I think that's kind of a hard question to answer on if we've handled it well. I think it's going to take some time as we get through this, being able to look back and assess what we did do well and what could we have done better on. I have been impressed with the profession as a whole and some of the grassroots efforts that have been made to get insurances to allow for telehealth and to reimburse for the telehealth. We've had the highs and lows with that, in that, we kind of all of a sudden Medicare came out and they were able to do the 97,000 series codes, but then we find out the next day that PTs are authorized practitioners for telehealth so I think that's some areas where we still need to focus our advocacy efforts down the road. I've been impressed with locally just the clinicians that we have, both our staff and other practice owners. Whereas before it might have been like, I'm going to kind of guard my marketing secrets and my business strategy secrets. We've shared a lot more with other clinicians because we're all in this together. and we've shared a lot more with other practice owners. I've got one practice owner, another practice owner that I've communicated with very frequently. We've been sharing a spreadsheet to update everything we find out about the telehealth. And so what does the place of service have to be for this insurance? What is the, if it requires some kind of modifier, what is that? And so, because it seems like some things have been changing with some of the insurances. And so that's, some collaboration we probably wouldn't have had before in the past. And we've been able to talk with we're part of a networking group of clinicians and owners around the country. And so that's been helpful to go through and share experiences, share difficulties, share some wins, if you will, that we've had. And so I do like that as a profession, we like to help people, and we're helping out our fellow PTs at this time. Our clinicians at our clinic have been very good at being flexible and open to the changes that have had to go through this. They've been instrumental in being able to develop some of the content that we're putting out there through our social media. They've all stepped up, and so I am impressed with that. But I think it's going to take some time to look back and be able to see, we did do this well. We could have done better on this, but again, I'm impressed with the effort that as a profession we are putting out there to be on the forefront of this pandemic. I do still try to have those touch points. So I think it's still important to have those touch points with patients, whether it is a phone call, email, through your telehealth session. We're still documenting all of our communications within our documentation system, so you're able to manage that. I think I think that's the big thing too, is to help those patients and make sure they are continuing along and still just having those touch points. Again, we're not, more than anything, we're educators for their care. So I think it's just important we still have those touch points. As far as being able to maybe help them, if it's, hey, they're at home and, they've need to progress from a retraction to now retraction extension. I think, again, MDT is the perfect system to be able to do that through telehealth. And I think most MDT clinicians you talk to, they'll talk about how they've helped a family member or a friend through a Skype session or even just over the phone. So I think it's just the biggest thing is having those touch points with those patients still on a frequent basis and letting them know that you are there. I'm trying to be as much of my normal daily routine as I can. So I am actually at home right now, but I'll be leaving to go to the clinic after this. I'm still, even though I might not be as much patient care and I'm not working in the business as much right now, I'm probably working even more than I used to on the business. And so I'm still trying to keep a daily routine. I think that's important, to try to come up with a daily routine. My daughter's 10, and we found out a couple of days before spring break that they were just closing the school early out here. And it was several weeks after spring break before the schools had their virtual lessons all set up. So we were just trying to keep our kids engaged with some kind of school work, some reading and math and those types of things on a daily basis. My daughter made up her schedule, and it had from from 9 to 9:30 was reading, and 9:30 to 10 was math, and whatever. And she even worked into her schedule her snack time and her lunch time and her recesses, because that's her daily schedule. And I think that's important. I think that's a lesson we can all just take, to try to keep a schedule as much as you can. But at the same time, I think it's important to realize that you might not be as productive as you were a few months ago. And I think that's okay to realize that you're not going to be as productive. We have people that are staying at home, trying to work home, and they're also now in charge of trying to educate their kids or be helping their kids with their education. So I think that's important to know. I think it's important to, I have to, with that schedule, I'm the one who has to schedule in my workout time, or else I will easily get busy with everything else, and then that falls by the wayside. And I'm lucky that in our clinic, we also incorporate a lot of functional exercise. So we have a lot of kettlebells and other things at the clinic that I can do my workouts from the clinic. I'm a part of a smaller gym that puts out daily, workouts on their Facebook page. I think if you're not a part of a gym that does that, I think you could certainly find something online to follow along. If you're not someone who can kind of come up with your own programming, find some kind of workout online. Through all of this, I've always had our Facebook page, but we developed a resources page that's more of a closed page for patients and former patients and other people we invite in, and we're putting more content on that, not only just for treatment-wise, but also just general health resources we find on that. So I think that's important to kind of be able to provide all that. I think it's important to get outside, and I think it's easy to kind of get holed up. So I think it's important to get outside, enjoy the time that you do have. I think that's another big thing is look for the positives in the situation that we do have. Maybe it's not so bad that we're spending a little bit more time at home. Maybe it's not so bad that we're spending a little more time with our family, that we're spending more times out in our yards. I think that's important. And I think it's important to make sure you're still connecting with other individuals. So whether that's, again, through a Skype or some other kind of video system, good old fashioned phone calls. I think that's important, or just talking over the fence with your neighbor. So I think that's things that we've all tried to do. And I think that's important to try to make it through all this. I'm trying to catch up maybe on a few journal articles that have had to pile up and kind of do that. So I'm trying to read up on that. I'm trying to do a little bit more reading, so I'm reading through kind of a couple different books right now. Unfortunately, trying to navigate through unemployment for our employees, and so that's where all of my education has kind of gone, and trying to work on some of those things. I wish I had more. I kind of at the beginning I was like, oh, I do have this time I'm going to devote to some other kind of clinical skills, continuing education, but I think if you have the opportunity, it's obviously a perfectly great time to, if you have a MedBridge subscription, or if take advantage of the McKenzie Institute's, the online learnings that they do have. So I think that's important to try to keep up with that at this time. And it's a perfect opportunity to try to catch up maybe on some education or some readings if you haven't had that opportunity for a while. We are having to change not only just physical therapy, but healthcare in general, I think is going to change for sure as we come out of this. And I think this is a perfect time. MDT clinicians are poised to be the leaders in demonstrating that as physical therapists, and especially as an MDT clinician, we can be and should be primary care musculoskeletal dysfunction clinicians. I think taking that opportunity to continue to, whether it's demonstrate those skills and knowledge through the treatment that we can. I mean, we've been considered essential healthcare, so we have been able to keep people out of the emergency departments, out of physicians' offices to treat some of those musculoskeletal conditions that maybe they would normally go there. I think we have to take advantage of that and take that and really run with that to continue to demonstrate that really is our expertise, and no one does that better than us. And I hope that one thing that does come out when we talk about what have we done well, I hope this is one thing that we continue to just move forward with, not only just as MDT clinicians, but as physical therapy professionals as a whole, that we are the experts in musculoskeletal, and we should be the primary care for that.